Many Texans have been frustrated over the difficulty of getting tests for COVID-19. Governor Abbott said everyone who needs a test would be able to get one. But we have heard from a lot of people who say they've had a hard time getting tested. We asked the governor and the commissioner of the Department of State Health Services for answers.
Here's the deal that people need to understand. There's a difference between everyone who wants a COVID test and everyone who needs a COVID test. And I'll let the doctor answer more about this, but I'll tell you my explanation having listened to this and other doctors, and that is the only people who need a COVID test are those who are showing signs or symptoms of having COVID-19. And there's no reason to give that test to those who are otherwise healthy. There is a singular reason why we want to test people, and that's so we can identify who has COVID-19 and isolate them so they don't communicate that disease to somebody else. We will be successful only by limiting that communication. That's the purpose of doing the test. There's no health care benefit to having the test run because there is no medication or medical treatment for the person who has COVID-19. But I'll defer to the doctor on all this.
Yeah, doctor, how do you determine that someone needs this test?
Absolutely. Well, as the governor said, it is really a combination of symptoms and, if you will, risk factors that need to be present. So the symptomatology, what we call influenza-like illness, so it really looks like the flu. You've got that cough, fever, cold symptoms, aching, all that sort of thing. And then do you have a risk factor? So one of the risk factors could be just being elderly and having underlying medical conditions. That should qualify people to get tested. Another would be contact with a known case of COVID-19, or the other could be travel from a region anywhere in the world, including now some places in the United States, where COVID-19 is undergoing, if you will, sustained community spread. And then the final category would be persons who are hospitalized with a very severe respiratory type illness, where the other diagnostic tests that have been done have failed to reveal a definitive diagnosis. So those are the situations in which we're using testing to its best effect.
We understand from Travis County, where we are tonight, that counties have to wait for approval from the state to perform each test. So we're told there's a bottleneck. Can you talk about that process?
Well, there's two ways to access testing, if you will. One is through the public health system, and we are using the very criteria that I just described to get that testing done. Really, the system's pretty efficient. People can call the local health department, the local health authority. They can have a discussion. If the person fits those criteria and we can get a sample from them, we can get them to any one of 10 public health labs around the state that are performing the tests. And the turnaround is really once it gets to the lab, it's anywhere between 48 to at max 72 hours, because we do need to batch the tests together so that we're having the most efficient use of the testing that we have available. And again, as the governor said, the treatment for COVID-19 is supportive. So unlike some other diseases where you have a specific diagnosis and then you have a specific treatment, knowing precisely what that diagnosis is in a timely way is extremely important. Here, we don't have those specific treatments, and so we would provide that supportive care to somebody who's sick, whether they have COVID-19 or not.
How can you fix the bottleneck, though?
Well, one of the things we think is going to happen again is what the governor talked about, is that we'll have more testing sites around the country that private laboratories will make available. Really, again, thousands of tests per week, and maybe even more in a very short period of time. So we expect that to come online any day now.
If I could elaborate on that, especially in response to the way the question was asked. The question was asked about the capabilities of public health, and that's what Dr. Hellerstedt's in charge of. And there's the Public Health Authority, say in Travis County, that will provide it. Understand this, there are multiple other providers of these tests. You've seen in Austin, Texas, for example, and other communities, drive-through tests. Here it's done by a particular hospital chain. Other areas would be provided by somebody else. In addition to that, through federal funding, there are now step-up facilities that have been provided in major cities across the state of Texas, where those facilities alone have the capability of testing 15,000 per week. And that's in addition to all the other private providers. So public health is just one slice of the multiple entities that can provide the collection and the testing.
What is currently the treatment for the virus itself, doctor?
Again, as I said, it's supportive care. So in other words, if somebody's ill, for instance, one of the things we recommend is that they stay home. They don't need to seek health care or even a diagnosis necessarily unless they get sicker, unless they can't take care of themselves at home. If they get to the point where they can't take care of themselves at home and need, for instance, supplemental oxygen or other types of treatments in order to maintain their bodily functions, that's the time that they're going to go to the hospital and get that supportive care. So by supportive care, that's in contrast to, say, something like influenza, for example, which in many cases we actually have very effective antiviral type drugs that can be given that really essentially shut off the reproduction of the virus. We don't have that yet in the case of COVID-19. And so what we have, again, is those supportive measures.
If you're a Texan sitting at home tonight watching this and you think you have the symptoms, what should you tell that person? What should they do?
Well,
Go ahead, sure.
really, again, if somebody has it, they should think about, you know, was I exposed to someone that I know has it, for example. Otherwise, if they don't have those risk factors that I mentioned earlier, they should, if they can, stay at home and recover and recuperate.
Okay. Could I add this? Because sure. This is very important. This is what we've talked about a whole lot. If you think you may have COVID-19, the last thing that you should do is to go to the emergency room or to go to your doctor's office. Because if you really do have it, you're exposing others to it. If you think you have it, you should call your doctor and visit with your doctor about what the correct approach is.
Is the COVID test free?
The COVID test is going to be provided for free to anybody who qualifies for it. The qualifier is a prescription by a doctor.